Hi everyone, thank you for watching this video with Nick Finnegan Counseling Center. I'm the Community Outreach Counselor, Tracy Lehman, and we are starting this video series to offer some resources and some support for everyone during this coronavirus pandemic. Today I have our Clinical Director, Audrey Omenson, here to talk a little bit about Telemental Health. Audrey, you want to introduce yourself?
Yeah, thanks so much. So we want to talk about telemental health, and we thought what better way to do that than through Zoom, because this is also what we use for our therapy sessions. And so by watching this, you can kind of get a feel for what that whole process feels like. So we wanted to kind of help demystify some of that, because I know that this method of doing counseling may be different or new for some people. But yeah, I've been the clinical director for a little over 5 years at this point. Worked at the counseling center for 6.5 years, and always learning new things. Like everything with all of this telehealth piece is a new territory for me and several of the therapists, but also thankfully is not new territory for mental health in general. There's a lot of therapists who offer telemental health as a regular part of their counseling practice. So we've been learning from them, and there's a lot of great resources. And so I really feel like we've come up with something at the Nick Finnegan Counseling Center that's a really good option for clients to still get a lot of mental health support right now. Because as I'm sure we've all experienced, the mental health piece is a big struggle right now for everybody. So I'm happy that we can do what we can to support that.
Yeah, there's been lots of trainings out there that all of us have been taking. Everyone's been offering resources. So in response to stay home, work safe, can you tell us a little more about how NFCC is allowing for continuity of care and continuous access for all those mental health needs that may arise or have already been going on?
Yeah, absolutely. So our 12 therapists total, all have had access to a free telehealth training to make sure that everyone's equipped and trained to know how to best provide counseling services through this type of a setting. And with the Harris County specific order for stay home, work safe, mental health is an essential industry, so we could have kept all of our staff in the office and everything, but to really promote the safety and be proactive around all of the health and wellness for our staff and our clients, and especially the counseling centers, since we're sitting in rooms and people are sharing furniture and all that kind of stuff. We really decided that the safest option across the board for everyone's physical health would be for us to stop doing most of our services temporarily, switch to the telehealth piece. But then the great thing about telehealth is that it allows for us to continue supporting clients and to continue to provide that care and support for the mental health and the mental well-being of all of our clients. And we've also even done some intakes and gotten new clients as well. And so this has been a really cool process and a really unique way. A majority of our clients have stayed on and are continuing to see their same counselors and do sessions with them. And so that's been a great way that we've been able to continue to support mental health while also supporting the wellness of the community as well.
Yeah. Can you, for those who aren't familiar, can you talk a little bit about what telehealth is exactly?
Sure, yeah. So telehealth is a phrase we're hearing a lot these days. Our medical doctors are using it, counselors are using it, all of that. So telehealth means that it's a health service that's done using some sort of electronic, non-in-person communication. So it doesn't mean just video sessions. It could also be a phone session. So maybe you have a phone call with your doctor, or phone session with your therapist, or maybe you do a full video interface like what we're doing in this talk right now. But yeah, so whenever telehealth is used, that means some sort of physical or mental health support from a professional done long distance using some sort of electronic component.
Yeah. I was reading when I was starting to learn about offering telemental health. I was reading a lot about it, and one of the things I thought was interesting was that a lot of us already use some type of telehealth. If you have an Apple Watch, you have that EEG thing where you put your
Yep.
finger on it and hold it. That's telehealth, which I had no idea. So
Uh-huh.
a lot of us are already, using that without even knowing it.
Yep.
So I know you told everyone already that we're using Zoom, and this is what we're using for our sessions as well. And just so all our viewers can see, you can switch your view on Zoom for whatever you're comfortable with. So you could even change it to a grid system side by side.
Yep.
But can you tell our viewers a little bit about what Zoom is and how this platform works?
Sure. So Zoom is, that's one that everyone is pretty familiar with at this point. A lot of schools are, using it. A lot of companies are using it and all of that. So Zoom is just one of the providers of virtual video meeting options specifically. So that's what they specialize in. And there's a lot of companies that provide it. Some provide it specifically for counseling practices, some other formats, but we've decided to go with Zoom because they had the best platform for a larger practice like what we have. And then within Zoom themselves, they also have a version that's specific for healthcare providers, which makes it HIPAA compliant and all of that. So you sign up for a different program with them if you're an actual healthcare provider. So they had that more secured HIPAA compliant option for us. So that's why we went with that. And it allows for us to do the video version of the counseling sessions with clients.
Awesome. Can you tell a little more? You already mentioned HIPAA, so kind of talk about how Zoom, the grade that we have or the level that we have of Zoom, how it helps protect HIPAA and confidentiality.
Sure. So yeah, absolutely. So whenever something is HIPAA compliant, that means that there are several extra safeguards in place. Some of them are actual technical safeguards in terms of encryption. They disable some of their, for Zoom specifically, it means they don't track anything in their cloud. They don't gather any data or information about the session at all, even like IP addresses and location, like nothing at all is tracked or gathered during all of that. So some of it has to do with specifics of the software and how it's made more secure. And then part of what makes this HIPAA compliant is also just the policies that we have in place for how the counselors use the app and all of that. So that means like if I'm your therapist, I'm sitting like where I'm at right now, I'm sitting in a confidential space. There's no one else around. No one else can overhear what we're talking about. It means that I make sure I'm using a secure password protected internet connection. And also means that whenever we set up the Zoom meetings, one of the things we do is enable the waiting room feature, which means that no one can join unless the counselor themselves clicks a button that admits them to the meeting. And so even if random people or the wrong person gets the address or someone, tries to join the meeting, they can't actually do it without that counselor actually admitting them. So that counselor has full power over who joins or not. And so like, it's a couple different layers of how we protect that. We also like the clients to be sitting in a confidential space so then nothing's being overheard on their end. So there's a couple different layers of that, but we have all of that detailed out in an informed consent. And it's actually listed on our website. So any current client who's using a telehealth option has read that and signed it. But if there's ever people who aren't current clients and are curious what all goes in terms of more detail of what goes into our process for how we keep things secure and confidential for this whole piece, then they are welcome to go to our website and read that form. It's just posted on our website right there. So that information is available for everyone.
Great. Yeah, and I'm glad you mentioned about the keeping strangers out, because I know the Zoom bombings have been in the news, people jumping in on classrooms and all kinds of things.
Yep.
Are there any other measures that we're taking to protect clients from somebody getting into their meeting, or any other information we need people to know about?
Right. Yeah. So that Zoom bombing kind of thing specifically, I've definitely been doing some research and tracking kind of some of the things related to that to ensure that we're always doing the thing that's the safest and most confidential for our clients. But what protects clients from that is exactly what I just mentioned a second ago. So one layer is we use the HIPAA compliant version of Zoom, which means that there's a lot of extra encryption and protection on what happens with the data of those meetings compared with maybe what a school or a regular person might be using. And then we use the waiting room feature. So anyone who has access to that link, you could click on it and want to join, but only the host, which is the counselor, so only the counselor can actually admit people into the meeting. So like they also have a password feature, but if someone somehow got the password, they could just join if they wanted to, but so the waiting room option is actually a little more secure than even the password piece, because there's no way anyone else could share that or access that meeting unless the therapist lets them in. And then we also make sure that we confirm the email address for the client, and we only send that link invitation for that meeting to that email address that the client specified. So we've got a few different layers there that prevent all of other random people getting access to sessions and all of that.
Yeah. No, I was really appreciative of that. I actually was in a counselor meeting with some other clinicians like a week ago, and they were talking about the Zoom bombings and saying all these concerns and what you can do to protect yourself. And as they went through the list of things to do, like using the waiting room and not using your personal ID to send out invitations, but giving everyone a unique invitation, like everything they said we already had in place. So I have to give you guys
the unique we do a random unique session ID every time also. So so we've I'm pretty confident that we're covering all of our bases on that front, and so far haven't had any issues or anything like that at all. So
well, thank you for doing such a great job setting that up so that we are fully protected. I really appreciate that.
We're all gonna have like subspecialties in IT work by the end of this whole thing. We'll all know how to troubleshoot every video thing. I think everyone in most of the developed world will have a lot of IT experience.
Yeah, telehealth is going to be a lot more well understood, I think, after this.
Absolutely.
So can you tell me a little bit, because it's different, it's a little different than in person maybe, or it just feels a little different, what a telehealth session would look like for therapy?
Yeah. Well, I mean, with how we're recording it right now, you're getting an idea of what just visually it looks like and kind of how it feels when you're in it. Also, at this point, a lot of you have done either FaceTiming or video chats with friends or for work or different things like that. So you've got a lot of people at this point have had that experience of doing like an actual video call with someone. And so with therapy, it actually, a lot of the conversation and everything flows very much the same as it would if you're in person. Things that I've noticed just as a therapist is, since I have fewer nonverbals to work with, because like as a therapist, you're trained to notice body language and how someone is in the room, and when you're in person with someone, you might notice things that you maybe don't notice in a video context. But I'm also finding that it actually brings up and highlights some unique things that I maybe wouldn't have known or noticed in person. And so like different types of questions, different insights, the way I kind of focus on the client and learn from them. It's interesting because it's actually highlighted some different areas with clients that I maybe wouldn't have known or thought about to ask previously, or that clients maybe wouldn't have brought up. But now that we're in their home context, they're maybe noticing or thinking about it in a different way. Some clients actually seem more relaxed when they're in their house. Like I've met a lot of people's pets, which has been really fun. You get to kind of meet and see, some of the spaces or, animals that are important to them. And so it's just really interesting. It's an interesting complement to the in-person sessions. And it is also such, I'm so glad we live in the 21st century where this is even an option for being able to continue to support people. And even if people are not feeling well or sick or have childcare issues and that kind of stuff, like they're still much more able to access therapy by having this as an option. So we're able to provide that support in a much more real time kind of way.
Yeah. No, I agree. I'm so thankful that we have this to offer people. I think it's just expanded our world and people's access to getting the care that they need so much.
Absolutely, yeah.
And I agree with you. I've seen some differences. I've had some really successful sessions through telehealth, which actually surprised me and brings me to another topic, which is that there is a lot of fear around using telemental health. I had a lot of probably misgivings about going online and doing video therapy before trying it. But now that I've tried it, it's a pretty close match. I still, think in person has its own, things and its own benefits. But yeah, seeing people's houses, seeing, people more comfortable in how they live, and that more, it's almost like another layer that allows for more vulnerability going into people's homes. So can you tell me a little bit about how your perspective was and may have been affected by having to switch to telemental health?
Yeah. So, I mean, it's so interesting because, like I said, like using virtual video and telehealth options for therapy isn't a new thing. There's a lot of therapists that have been doing it with clients for a long time. And it's especially helpful with clients in rural areas or where just like access, like physically being able to get to a therapist's office just doesn't work for them. And so I've, heard and read about a lot of the positives of all of that for a while. But I mean, I've always, this is like this last month and a half is the first time in my career of over 10 years that I've ever done video sessions. I've done some phone sessions in the past with clients, but using a format like this is the first time. So I was, I wouldn't say I was feeling wary about it, but I wasn't necessarily excited about it either. Not that anyone's excited for a pandemic to happen, but, my preference was definitely in person, but I found that I've still made like clients, we've still had some like really productive and really good sessions in it. And it's just a different, I wouldn't say it's better or worse, it's just different. And there's still a lot of overlap. So it's not like it's a completely black and white difference. It's more like Venn diagram kind of a thing. The circles overlap a lot, but there still are some things that are slightly different. And I've noticed with clients too, like, those clients, they chose to come to a counseling center where they come in person. And so all of our clients have overall showed great flexibility and willingness to try this new format. And overall, our sessions have actually been increasing the last several weeks, just as people have been home more and have decided that they do want to get that support and all of that. We've been increasing in our session numbers. And I think it's because people are realizing like, oh yeah, this still works. Like maybe long-term I'd prefer in person, but like this is still a really great support and option right now. So people still get that extra support, can still make some progress with the stuff that they're working on, can process just all the amount of stuff that keeps changing and happening. And being able to do that where everyone can also be taking care of their physical health and staying safe in their homes and all of that.
Yeah, being able to keep others safe while still helping to support them and be there for them.
Yeah, because you also have to take care of your mental health and all of this, right? Like that's one of the tricky balances right now is how do I, not lose my mind in all this process, but also do what I can to pay the bills and make ends meet, or stay 6 feet away from people, or care for my kids, or everyone's situation is magnified by a million right now. And so this telehealth option lets you still have some of that mental health support that's so important while you are navigating a stressful and overwhelming global situation.
Yeah. Yeah. And even the insurance companies, I'm so excited that the insurance companies
Oh
are
yeah,
stepping up and getting on board with, offering some extra coverage for these sessions.
yeah, absolutely. Yeah, it prior to all of this happening, insurance companies, some would cover telehealth, some wouldn't, or they maybe had some qualifiers around it, and that sort of thing. But mid-March, at least all the insurance companies that we work with switched to approving all forms of telehealth coverage for mental health related support. So phone, video, both of those things are covered by insurance companies now, which is huge.
Yeah, it's a big step.
Mm-hmm.
And the other thing I found is, because I work with children and teens too, I find that children and teens are really comfortable with screens. This is like,
Oh
I
yeah.
didn't grow up with screens. Like from a child, I wasn't like, always on a screen, but um, these next generations, they've had technology their whole lives.
Yep.
They're comfortable interacting, or even
Yep.
more comfortable interacting through a screen. So I
Yep.
found some really positive things with
Yeah,
working.
I'd say some of my sessions with some of the adolescents that I work with have arguably been more connected,
Yeah.
and we've gotten more out of it than not. So it's interesting. Yeah, again, like this whole thing, it highlights different elements of therapy, and in some ways it can make it a lot more powerful. So
Yeah.
it's been interesting to see and to learn how to really use this format well.
Yeah. One of the things I was really nervous about, because I work with really young kids, as young as 5, and I know some of our other clinicians see kids as young as 3. Um, so I was really worried about how doing a play therapy type session, like with a child, because they communicate with toys and play mostly, was going to work over a screen. And it hasn't been too bad, actually. It's been working pretty well. Can you tell everyone a little bit about what a child telemental health session would look like?
Sure. Yeah. I mean, it's so interesting. And again, it's not a new therapy format. It's one that people have been doing a lot. And so it's been really interesting to see. And a lot of therapists have, like a lot of professionals right now are really wanting to connect and share resources and learn and all of this. And um, so, yeah, with play therapy through a telehealth format, it can be actually a really cool thing, especially since it's the kid's own space. And you actually have to use more creativity
Yeah.
to engage over a telehealth format than maybe even in person. So in some ways, it engages that creative piece even more. But I will say a few of the things, and it can look really different depending on the client. But I do say with all the minors, there always has to be an adult that's present in the house. Typically, especially with the young kids, the parent will be part of the session at the beginning and the end, just so they're, getting the device set up and checking in with the therapist and all of that. And then maybe kind of depending on the plan with that child, the parent may step out of the room for 10 minutes or 30 minutes or, a certain amount of time so that child can have some private time to process things with the therapist. But yeah, like doing shared art projects across the screen, doing like therapy scavenger hunt. So like find something for therapy, show and tell. So find me something that makes you feel really connected to someone, or show me something that reminds you that you feel really loved, or what's one thing that reminds you of someone that you really care about. Like there's a lot of different really creative kind of fun things. And Tracy, I'm sure you have some other things that you've come across as well. But there's some really cool ways to really engage and play even over a telehealth format with kids.
Yeah. I'd say it opens up my kids' creativity a lot too. Like they figure out new ways to engage with me and connect with me and express themselves that are really creative. Um, some other things I would mention about setting it up is if your child, is younger, then having mark off like with a blanket or something where the area where the camera, whatever camera you're using, can see the child. That can be really helpful. And then, you can, if you have a ton of stuff and you're worried about being a mess, just like have your child pick out what toys they want before the session that they would like to share with their therapist in session.
Yeah.
So those have been some helpful tools I have for that. But it's been really good. I think the kids love it. It's actually really exciting for them, especially I think because they've been so isolated to have that interaction with someone, especially if they've been coming and they're
Yeah.
familiar with their
Well, and
counselor.
parents seem grateful to have something kind of structured and set for their kid for an hour, and have also, I've heard, gotten some help from the therapist in knowing how to like kind of help support their kid and navigate all of this stuff while they're all at home, and making it day to day through all of this as well. So
Yeah.
yeah.
Yeah. So if someone's interested in starting therapy through Nick Finnegan Counseling Center during this stressful time, how would they go about scheduling a session or getting started? What would that look like?
So you do it just like any other time. So just call our main office number. It's listed on our website, but it's 713-402-5046. So our hours are the same. We still have staff answering the main line. We've been able to set all that up where we can work safely and remotely and all of that, but also still be available to our clients in the same way. So yeah, just calling our main line, asking to schedule a session. You can ask any questions you have. All of our staff are trained to know how to explain, how we set up an appointment and do all of that process. And then all of our intake paperwork is on our website. So you can go there and download that and fill that out. We have them all set up as electronic forms. So you can actually, since not everyone has access to a printer and all of that kind of stuff right now, so you can actually fill them out electronically and send them back to us in an electronic format to make that process easier as well.
Yeah. Awesome. Well, thank you so much for
Yeah,
all that fantastic information. I'm glad that we're here to support people through this medium.
Yeah, me too. Yeah. Because again, as we're all seeing and experiencing, like the COVID thing itself is a really stressful and overwhelming thing. And then there's this second layer of this social distance piece where we're not able to be around the people that we really care about, or if we are having to be around people, depending on what our job is, different essential workers and stuff, it has a much higher stress level to it. So like being around people isn't just the easy, comfortable thing that maybe it's felt like in the past, or some people, their home is not a safe, comforting place to be. So this is especially a stressful time for all of that. So there's a lot of layers to what's going on. And I'm just really grateful that, technology, there's this option to do this electronic long distance format where, at least in the ways that we can, we're able to support and care for our community in meaningful ways.
Yeah. Yeah, I agree. It's been amazing to watch all the health community come together to offer support during this really uncertain
Totally.
time.
Yep,
Yeah.
absolutely.
Yeah. All right. Well, thank you so much.
Thanks, Tracy.
Yeah. And thank you guys so much for tuning in, and we will see you next time on a new topic.
All right.